Addiction to Vaping, a Farmington High School guide for students. The topics we will cover in this module include why e-cigarette use is increasing, how nicotine in e-cigarettes leads to addiction, symptoms of addiction, the effects of nicotine dependence on the teenage brain, and withdrawal symptoms. E-cigarette use has been quickly increasing in the past several years. According to childmind.org, e-cigarettes are now the most frequently used tobacco product among adolescents. Some 2.1 million middle and high school students were e-cigarette users in 2017, far surpassing traditional combustible cigarettes. The increase is due to a number of reasons, including easy availability, effective advertising tactics, the variety of flavors available to e-cigarette users, the belief that e-cigarettes will help a person quit smoking cigarettes, and the belief e-cigarettes are safer than smoking cigarettes. Let's look deeper into one of the beliefs about e-cigarettes. Currently, e-cigarettes are advertised as a way to quit smoking combustible cigarettes. However, e-cigarettes are not approved by the Food and Drug Administration as a method to quit smoking. In fact, studies have shown that individuals using e-cigarettes as a means to quit smoking don't actually quit, and instead continue to use both cigarettes and e-cigarettes. Another belief regarding e-cigarettes is that they are less harmful than combustible cigarettes. While it is true that e-cigarette aerosols generally do not contain as many toxic chemicals as combustible cigarettes, that does not mean they are not harmful. In fact, recent studies have shown e-cigarettes to cause high levels of cancer-causing agents in the bloodstream, a lung irritation similar to that of combustible cigarette smokers, and an increase in heart rate, blood pressure, and circulatory problems. These studies have also shown e-cigarettes to cause a decrease in immune system function, a decrease in focus and attention span, and addiction. One of the biggest concerns with e-cigarette use is their potential to lead to addiction. We know that e-cigarettes contain high levels of nicotine. For example, Juul advertises that one pod of e-juice liquid contains the same amount of nicotine that is found in one pack of cigarettes. That's a lot of nicotine. This alarming amount puts any individual who uses e-cigarettes at risk for addiction. Another reason nicotine can lead to addiction is because of the feel-good effect. Dopamine is a neurotransmitter that carries the feel-good messages that cause the effect. We release dopamine naturally when we do something that gives us pleasure, such as eating good food. However, when a person uses a product that contains nicotine, it also causes the brain to release dopamine into the reward circuit, and therefore the feel-good effect occurs. This feel-good effect wears off quickly, causing people who use products with nicotine, such as e-cigarettes, to want to use them again. This is what can lead a vaping hobby to an addiction. Symptoms of nicotine addiction include not being able to stop using e-cigarettes, the occurrence of withdrawal symptoms if an individual tries to stop, continuing to use e-cigarettes even though an individual is experiencing health problems, and giving up social or recreational activities in order to vape. Becoming nicotine dependent is a high concern for teenagers because the brain is still developing until about age 25. When the developing teenage brain is exposed to an addictive substance such as nicotine, it permanently changes how the brain develops. This means a person can have problems with learning, attention, memory, and thinking later in life. It also makes a person more vulnerable to developing other addictions in the future. The more a person uses e-cigarettes, the more the brain and body gets used to having nicotine in its system. This makes it very hard for the body to go without nicotine. If a person stops using products that contain nicotine, such as e-cigarettes, they will experience withdrawal symptoms. Symptoms of nicotine withdrawal include feeling irritable, restless, or jittery, headaches, an increase in sweating, feeling sad or anxious, feeling tired or groggy, having trouble thinking clearly or concentrating, having trouble sleeping, feeling hungry, or having intense cravings for e-cigarettes. Now, consider if you are addicted to vaping by answering the following questions. Do you continue to vape even though you want to stop or think it's hurting you in some way? Do you feel anxious or irritable when you want to use your vape but can't? Do thoughts about vaping interrupt you when you are focused on other activities? Do you still vape after getting in trouble with your parents or school for vaping? Have you ever tried to stop but couldn't? Do you feel like you have lost control over your vaping? If you can answer yes to one or more of these questions, you may be addicted to vaping. Please continue on to the next module, where ways to quit vaping will be explored.